Welcome, everybody. Thank you for being here with us today. So the way that this is going to work, we're going to start out just with me and Rachel talking about some things that we think are really essential skills and things that everybody should know if they're taking care of a fragile kitten coming into them. And we'll just have a quick discussion about that. And then we are going to try to dedicate a lot of time to your questions, because I know how fortunate I am to have Rachel's ear all the time. And I think it's awesome that you guys can have her ear today too. So the reason we wanted to do this talk is because when you get involved in kitten rescue, you often are getting in kittens who don't look so good. They come to you and they don't look good, and you're not necessarily going to be sure what exactly is going on with them. The actions that we take in those first 12 to 24 hours are so crucial, and it can be difficult to know how to assess what's going on and how to stabilize those kittens. So that's really the topic for today. One of the most important things, of course, is having a good relationship with a veterinarian. So that is why Dr. Rachel Wallach is here. She's like one of my BFFs, and also my veterinarian, and also the person I talk to like probably more than anyone. She is on the board of my nonprofit, Orphan Kitten Club. She's a big part of what we do. She's a kitten rescuer herself who always has like a revolving door of babies. And she also owns Oaks Veterinary Urgent Care, which is an urgent care hospital in Agora Hills, California. So she has a ton of valuable experience. And we thought it would be valuable for you guys to kind of see a conversation between the two of us. So thank you, Rachel, for doing this with me. Rachel, I wanted to start with kind of like a broad overview of where your mind is when you're bringing in a new intake, a kitten who you need to assess. And you do something called a SOAP. Can you talk about what a SOAP is and how you do it?
Yeah. So, first of all, thanks for having me. And so a SOAP is our medical record, and it's broken down into 4 categories. S, subjective. So like the story that you're told, which is subjective because, a lot of times people's emotions go into that story and then they start to add in these details that they think are happening. Then is the O, objective. So what are you objectively seeing and observing? So that's where I'm putting in the actual facts plus, oh, sorry, my dog is joking, plus what I'm observing. So my physical exam, my nose to tail kind of exam. The A part of SOAP is assessment. So I am putting in like, okay, I've decided that it's got fleas, dehydration, blah, blah, blah. And then P, plan. What's my plan of action? And then, so that's how I go through. And I try to go through each case like that so that I'm always going in a specific order and I'm not overlooking things.
That's really, really helpful. And I think I really love how you talk about like the subjective and the objective, because both have value. But it is true that sometimes somebody brings me a kitten and is like, this is what's going on. And they, there's a lot of emotion and they say, this is what's going on with them. And sometimes like members of the public can be quick to sort of self-diagnose what's going on in a situation. It's valuable to have their take on what's happening in those details, but it's also important to look with fresh eyes.
Absolutely.
So you mentioned nose to tail. That's what we're going to spend the bulk of the next like little bit here talking about. Is I feel like a lot of the time I don't have time to do this in talks, like talking about really like what are you looking for each little tiny thing. And that's what I think is really valuable today that we can do, is going through from nose to tail. You're looking at this kitten. What are you looking for? What are we really assessing here? What skills and supplies might we need to deal with each of these things? And then where do these things fall on the priority list, and when do you go to a vet? Now, I know for you, when you're assessing, like you're doing it pretty fast, right?
Yeah. And that's the thing, is it's meant to be an overview, and it's meant to also be something that you're continuously doing, checking in. And so where your starting point is and where you end up is going to be different, but it's just a good thing to do in a specific order so that you're not missing body systems.
For sure. Okay, so let's go through some of those body systems. And some of these are going to be way more critical for us to spend a lot of time on. But just thinking about starting with the face, let's talk about eyes. So you get in a neonatal kitten, and what are you looking for with their eyes?
Open or closed. Okay, just giving us a baseline of how old they are. Gunky, crusty, goopy, pus filled, that kind of stuff. So that gives us a clue about, do they have an underlying illness going on? Or are they bright, shiny, nice? Eyes, we're done.
Yeah. Yeah. And I think also another important thing is like sometimes eyes are shut because they're crusted shut. And sometimes eyes are shut because it's a neonate. So it's important. I mean, one thing you can do is just open the mouth and look and see if they have teeth. If they don't have teeth and their eyes are shut, there's like a pretty good chance that they're just a neonate. But if you see a little bit of discharge or crust, but their eyes are also shut, then what would you recommend to people to do?
I mean, you can just take, a warm washcloth and apply it to the eye and hold it there for about 5 minutes, and that'll start to break down some of the crust. Now, if you do that to a neo who doesn't have crust in the eye, nothing's going to happen. Please don't pry it open though. But if you're starting to being able to wipe away debris, which you should see, usually with neos that just have their eyes closed, there's not actually debris or anything around them. But yeah, using that warm washcloth, just gently soaking and then wiping away and seeing if eyes appear.
Sure. And priority wise, this may not be the first thing that you need to do, but I would say I get a ton of kittens like this where there's like a lot of different things going on, one of which is that their eyes are crusted shut. It's not the first thing that I'm going to do, but it is something I'm going to do like that night. Like I'm going to do it, once everything else is stable. Because I think you also don't want to leave them like that, right? Because if there is like infection going on, you don't want to just leave that closed, right?
For sure. It's more about, at this stage of the game, just taking note, filing that into your, okay, there's an illness going on, okay? So, and if there's gunky eyes, ears, eyes, nose, throat, those are all connected, right? And sometimes lungs as well. So just putting that in your brain of like, okay, I'm going to be looking for those other clues and signs.
For sure. It's like being a detective a little bit, right? You're like, okay, very interesting. And you're totally right that if one thing is going on, after a while, you start to make connections of like, okay, if that's going on, probably let's look at these other situations. Okay. But in terms of priority, eyes, not your top priority in an emergency situation. Did you want to say something else?
Oh, I was just going to say, like, think about it is in your own body systems too. If you have crusty eyes or snotty nose, think about the things that would go along with those things. And if they go along in with you, they're often going to go along with the kitten.
Yeah, that's a really good point. Okay, let's talk about nose. So what are you looking for with kitten nose?
So sneezing and or crusting, discharge, essentially. I'm not looking at temperature, wet, dry, anything like that. We don't use that as assessment. I love when people come in and they're like, the nose is dry. And I'm like, okay. What we're looking for is there something obstructing breathing? Like if it's so crusted shut with mucus that they're not able to breathe, or you're seeing, or they're open mouth breathing, that kind of stuff. That's what I'm looking for. Or I saw crusty eyes. Is there crusty nose? Do I see any discharge? Yes, no, maybe so. If it's not obstructing breathing, move on.
Mm-hmm, mm-hmm. Yeah. And can you talk a little bit with that about like, because I think with respiratory, like upper respiratory, I think sometimes I see people panic too much about it. And sometimes I see people not take it seriously enough and wait until it gets really bad. So if you get one of these kittens who's got like a crusty nose, where would you say that falls between like, oh my gosh, we have to go to urgent care right now, and I'm not going to worry about this, we'll just see what happens? Where does that fall for you?
So for me, most upper respiratory infections are not urgent care material. However, upper respiratory infections love to then develop into lower respiratory tract infections, and lower is, here down. So if we're involving the lungs, then we definitely want to go to an urgent care. But what we're trying to determine is this an emergency or is this urgent? So urgent is something that needs to be addressed within the next 24 hours or so. Emergency is now,
Yeah.
Making that distinction of, are they going to die right now if we don't actually pursue treatment this second, versus are there things we can do to make them more comfortable and help, and then within this next 24-hour period pursue veterinary care? And
Sure.
it's a really important distinction.
Yeah, and I think it's a difficult, probably, judgment call to make if you're not used to seeing a lot of kittens with respiratory issues. But again, like, one thing can also indicate another. So we'll talk about lungs in a little bit. I totally agree with you. If you're feeling like rattling in lungs, or you're hearing lung sounds, like, that is way more of an emergency to me than just like some crusty nose.
And Eliza said here, would you do nose or eyes first? Doesn't matter, pick one. But pick one and do that order, every time, so that you're going through it in a systematic way. The only thing with nose is sometimes, and this is really common for respiratory infections, and this freaks people out, is that the nose or the nasal passages or the throat has mucus in it, and it sounds really bad, and it sounds like your kitten is having a really hard time breathing. And so people panic, but it's not actually down in the lungs. And so trying to listen and to feel whether you're feeling rattling, gurgling, anything like that in here, and seeing if we can empty these spaces, and that improves it.
Sure. Really good point. And the other thing I just want to call out is, if a nose is stuffed up, there are like other side effects of that. For instance, not being able or willing to eat. So that is another thing that when I see, okay, your nose is stuffed up, my next thing is that why you're not eating, or is that going to be precluding you from eating? In some cases, yes, in some cases, no, but it's just an important thing to kind of note.
Absolutely.
Let's move on to mouth, because mouth, I think, is really important. It's definitely one of the first things I look at. So can you talk about gum color? When you have a little kitten and you get them in, you're going to kind of lift their little lip and look at their gums. What color do you want to see? What colors don't you want to see? And what could it mean?
So, what you're looking for when you're looking at the gum color is essentially how well the heart is perfusing the body with blood, and blood supplies oxygen. So you're essentially looking and saying, what color is this? Does this look nice? So most babies, and I mean, if you have adult cats at home or dogs, look at their gums, you'll see they're a pretty nice pink color. Most babies are quite a light pink. It's almost like a pale pink. And the more you get used to looking at those gums, the more you'll know what normal is and what abnormal is. So some kittens will present with white gums, okay? And white is scary, or can appear scary, because people think, oh my God, they're so anemic, they might be bleeding to death. But white is like, again, this goes back to blood supply and oxygen. And so white can be, blood's not supplying the gums because they're really cold, and blood's all being shunted over here and away from less important things. It can be nausea. It can be pain. When you get nauseous and your face gets all pale, same thing with the gums. So those are some things to take into account. Blue or purple, never a good color. You see those colors, get yourself to a vet. It means your baby is struggling to breathe, probably not going to survive if you're not going to get emergency veterinary care. And then in rare cases, you're going to see really, really dark pink injected, almost, some people call it brick red gums or mucous membranes. So we refer to them as mucous membranes, but just gums is fine. After, how you guys see like a baby suckling on a bottle or a nipple, and then their tongue turns really nice and deep pink because there's a lot of blood supply going to it. We'll often also see that in animals that have a pretty massive infection going through the body. For most rehabbers, the important thing is just getting to know what's normal, what a normal light pink gum looks like, and then if it's blue or purple, bad. And that's where I would leave that. I don't think you need to go more in depth in that,
Sure. And I think that you make such a good point about the importance of looking at these things, even when your kitten is really healthy, like get used to
when it's healthy,
what the temperature of a kitten looks like when they're healthy. Get used to what the gums of a kitten look like when they're healthy, because then, experience is going to help you notice when something is really abnormal and you're going to go, this is really strange. So we talked about gum color. Can you talk a little bit about the feel of gums?
Yeah. So, and again, these are things that are used more in a little older kittens. But they should feel moist. Okay. Not like dripping moist and not, just sort of like you put your finger on them. It's slick. It just can slide. If they're sticky, then we worry about dehydration. Okay. And so in adult animals and in like pediatric age kittens, 4 to 8 weeks, it's going to be more effective to help you. With babies, it's not like under 4 weeks, it's not necessarily that helpful. And then nausea or hypoglycemia, oftentimes you'll have a profuse drooling. So touching the gums and it being like really slick is not going to help you, because you're like, oh, it's really moist, but that can mean that there's still dehydration going on.
Sure.
But in babies, I don't usually use the feel, but again, get used to feeling a healthy adult animal and just, again, knowing what your normals are, so that when something's not normal, you're like, oh,
Sure. Okay, moving on from the gums, there are other things we want to look at in their mouth. The palate, I think, is something that hopefully is going to be normal in most of your kittens, but sometimes it's not going to be normal. What would that look like?
So sometimes if there's going to be a cleft palate, you'll also see like a cleft in the lip and potentially into the nostril. But also if you're looking up into the roof of the mouth, you're going to see a gap if there's a cleft. Clefts aren't that common in some areas, or some people just, some people just tend to get all the cleft babies and some people don't. Hannah gets all the poo babies. It's just like one, you're going to get like one specific thing. So,
I feel like it goes in waves and there's like years where it's like, oh, this is the year of ringworm. This is the year of what,
right? Yeah. So I think, just having a look, it's really important. And then don't freak out. There is a bump at the roof of the mouth. Okay. I can't even tell you how many people have brought cats and kittens to me because they're like, oh my God, there's like a mass in the roof of the mouth. And that's just a normal anatomic thing.
I feel like don't we all have that?
Yeah.
I can't help them.
How do you open them safely? Someone is asking you, you're just going to lift. And I like to lift like right here where the canine teeth would eventually, and just have a good look. And again, looking at normal so that we know what abnormal is.
Sure. Yeah. The other thing that's important looking in the mouth is that the teeth can help you determine age better than a lot of other measures can. So I look in a kitten's mouth because maybe you get a kitten and you're like, okay, this is like 100-gram kitten and their eyes are closed. So it's probably like a 1-week-old, like a 5-day-old kitten. And then you open their mouth and like, if they have all their teeth, you'd be like, okay, this is horrifying. This is a many-week-old kitten whose eyes are crusted shut and is not doing well, So, I mean, that's a pretty extreme example, but the point is, the teeth are a really good measure of age. I do have a lot of resources about that online already, so I don't think we should go all the way into that. But under 3 weeks, not going to have teeth. 3 to 5 weeks, the teeth are gradually starting to come in. So just good to know.
But yeah, please, if you can, familiarize yourself with that, because I get a lot of rescuers who are actually super great with what they do and looking out for things, but they miscalculate age on babies. And so I have a baby right now that I just got, and I was told it was 2 weeks old, but I opened the mouth and it's got teeth. And I'm like, it's not 2 weeks old. And not only how I calculate medications, calculate feedings, nutritional requirements, all those things, fluids are all going to depend on neonate pediatric, and so just really familiarizing yourself with, when do teeth sprout?
Yeah. And like I said, I have some resources on that. So if you're not sure, you can go on my website or in my book or in any of my other webinars. I'm trying to think when I cover it. I think I cover it in my bottle baby webinar at kittenlady.org/webinar. Let's move along to hair and skin.
Pause. Last thing, in the throat, in really sick kittens, have a good look and just make sure. I've gotten a lot of sick kittens, like animal controls brought in, maggot eggs in the back of the mouth. Okay, maggot eggs, bad. But just make sure you're not seeing like blood, pus, maggot eggs. They're disgusting things.
You're going to notice if something weird is going on back there, but you're not going to notice if you don't look. So just take a look. Okay, let's talk about hair and skin. Obviously, I feel like I get so many of these kittens who have been outside for a long time. I get kittens who have been out in the rain or in the mud or in the dirt or who have, external parasites. So can you talk about how you would know, and what are you looking for when you're looking at their fur?
So when I'm looking at fur, it's really just a brief look.
Yeah.
And you can go in depth later, but if we're talking about the first 24 hours in this sort of critical period, usually fur is not, fur and skin is not going to be my most exciting piece. So fur, I am having a look through. Do they have fur? Are there missing patches of fur? So, giving me ideas of like, if they're missing patches, what would cause that? And, things would cause that. But again, nothing life-threatening. Do they have parasites? Am I seeing little black grit, like flea grit? If I'm not sure, collect a little bit on a piece of paper, add some water. If it turns bloody, that's flea poop. Am I seeing maggots? Again, yes, maggots need to be dealt with, but not life-threatening in that second. There are lots of other things that are going to be way more life-threatening. Disgusting, but not life-threatening. So just identifying things that need to be dealt with, and then we're going to come back and deal with them.
Yeah. And at the end of this discussion, I think we'll go through some of the recipe book of what comes first. And I can say, it's probably 6 months ago, I got a whole litter of kittens and they were covered in fly eggs. And my first instinct is I gotta get this off of them. But then the part of me that is experienced goes, okay, no, get them warm, get them hydrated, and then get those nasty fly eggs off of them, right? So there's an order of these things. It's not that it's not important, but it's not immediately life-threatening to them in the first hour that you have them. I have a lot of people that bring me kittens who I can clearly identify ringworm on, but people are not used to looking at it. So if you see crusty skin, missing fur, I know Rachel's I already know what you're gonna say here when I say make sure you're washing your hands and put on gloves. Rachel's gonna say you should always be washing your hands and putting on gloves, which is definitely true. But especially if you're seeing missing fur, take that really seriously. Not life-threatening, but it could be something that can be spread. So being mindful of that. What about wounds and abscesses? I think that can be really scary for somebody. Where does that fall on your priority list?
Low, unless we're talking the head's gonna fall off. Again, obviously a massively bleeding wound. Again, most of these things are urgent, but not emergent. And so, like if we identify an abscess, okay, we've got to treat that because it's causing infection in the body and that kind of stuff. Or if we have a really nasty wound, something that needs to be dealt with, but not necessarily that second. Because again, there's still things that are more critical to deal with before that. And then the other thing I have to say about skin is the best place to see skin is usually the belly on kittens. It's naked for most cases. And so that's a really good space to look and assess hydration, because gums aren't going to really be that helpful in a baby, but the skin on the belly is. And so if you're looking, the skin and it's wrinkled, sort of like shrivelly, that's suggestive that there's dehydration. Where if you start getting used to normal, healthy pink baby bellies, and as they get older, obviously you're getting fur growing on that area, but just getting used to that normal, healthy, plump little pink baby belly, and anything that's not that should be a clue that something might be going on.
I really echo that, because every kitten I've had who's been suffering from something that's causing dehydration does have that like wrinkly belly. And I don't know, if you don't have a ton of experience looking at kitten bellies, you might not notice that that's weird. So I guess our directive to everybody is spend more time looking at kitten bellies. I know it's really hard. It's a really cute thing actually to do, looking at kitten bellies, but it is important to know like the difference between a hydrated, smooth looking skin of a belly versus kind of like looks like crinkled, like crinkle paper.
It does. And the other thing too is that the younger that they are, the more see-through they're going to be. You're going to see veins and vessels. You're going to see the spleen. You're going to see the stomach. I mean, and you don't really need to care too much about that. But if all of a sudden you see like a big blue protruding something or a, whatever, that should alarm you.
Let's stay on this for a minute and talk more about like the abdomen and what you're looking at. A lot of kittens are going to have their umbilical cord if they're like under a week old. What would you say to somebody who gets a kitten and they have this really long umbilical cord hanging on? What is important for people to know about that and making sure that kitten is healthy?
Yeah. So umbilical cords, you have to remember, are the direct link from baby to mom, or the placenta, which mom. And so it's this vessel, and people don't think about it this way, but it's a direct access with blood supply now to the open world, right? And kittens are born with this sort of blank slate immune system. They don't really have one. They actually come out of mom with no bacteria in their gastrointestinal tract. And then all of a sudden we have this umbilical cord that's just a big open line straight into the body and straight into the bloodstream. And so it's really important that we handle the umbilical cord with respect.
For sure.
And so, one, wearing gloves or making sure your hands are super clean. Two, it doesn't need to be that long because we don't want it to catch on things. We don't want it to wrap around kittens' legs and tie off, we've seen kittens where it ties off the blood supply and then legs need to be amputated. What you really want to do, grab a little bit of dental floss or some little string, tie the umbilical cord off, maybe like this far from the body, tie it off really well, snip with clean scissors that you've washed with like rubbing alcohol, hydrogen peroxide, iodine, snip it. And then you want to clean the tip of the umbilical cord and the area right around the belly up to the skin, okay? And the ideal thing you're gonna do is clean that with iodine or betadine. You can get it over the counter, any pharmacy, and you're gonna wanna put like a couple drops into some water, make it look like an iced tea solution, like the color of tea, and then take a little cotton ball and make sure you just
like your dog.
Yeah, he's hit the phase of the morning where he's being demanding. So yeah, basically you want to make this iced tea solution of iodine or betadine and just try to get the bacteria off, because again, that's just an open line straight into the body. And I think we don't even think about how likely infection can spread in through there.
Sure. I just want to clarify quickly, when you're talking about like tying off and trimming, you're talking about a fresh umbilical cord, not a dry umbilical cord. Is that right?
Yes. If it's dry, then I still recommend doing a little betadine or iodine right around where the umbilical cord attaches to the belly. But if you want to dilute, if you want to, sorry, not dilute, if you want to trim that umbilical cord, you can. Again, clean scissors, please. Give them a wipe with alcohol or something.
But never pull an umbilical cord off, never like try to remove the whole thing. It falls off on its own, but it is important to keep it clean, especially like you said, around where their belly button is going to be. I think a lot of people don't realize that kittens can like develop sepsis via the umbilical cord, and sepsis is a
common ways
#1 killer of kittens. So sticking with looking at the
sorry.
It's okay, they have a lot to say too. Sticking with looking at the abdomen and the GI tract, what else are you looking for, like in terms of the feel of a belly or the color of a belly?
Yeah. So again, like that nice pink, like sort of, it's soft, squishy and pink, but at the same time, like not doughy. You know, when we start to get into dehydration, bellies start to feel sort of like bread dough. These sort of
like when you've been like letting your sourdough rise before you put it in the oven, and it's like, yeah, I know what you mean.
Yeah. Someone said, what is an umbilical area or herniated? That's later on, and you'll just see a bump, and it's not anything I would worry about imminently, which is something I would address when you're seeing a vet.
Sure, with that. Okay, another thing that I really think is so important for us to talk about is appetite, which has to do with the tummy. It's not something you're looking at on them, but I think a lot of people, myself included, when I was first getting into this, you rescue a kitten, they've got all these things going wrong, and the first thing you're thinking is like, oh my God, they won't eat. And I think it's really important for us to talk about what priority level is eating as opposed to other things. So what would you say to someone who's like, I just took in a kitten and it's been an hour that they've been here and they don't want to eat?
I would say that that's likely because we haven't addressed some underlying issues that are way more important to be addressing. And I know the first thing, as a Jewish mama, I know the first thing is we gotta feed.
I want to feed you. I'm the same way. I'm like, you see a hungry kitten and you're like, I gotta feed you, and I gotta feed you so much that you're like suddenly perfect body condition. But that's actually not. That's not the way to get to perfect body condition.
And we can actually do a disservice to a kitten who's not ready to eat. Warmth, fluids, a whole bunch of other stuff, is much more important than getting them to eat. And then what I would say is, until we've addressed those really critical things and brought the rest of the body systems to as close to normal as possible, eating is going to be a much lower priority. And I know people are like, what? But there are more important things like hydration, warmth, this, that, and the other.
Yeah, and I just, speaking from experience, I can say I have kittens who come here and they might not eat for the first like 6 to 12 hours that they're here, but that doesn't mean that you're not addressing the more critical things, which is like, are they warm? Are they hydrated? Are they hypoglycemic or not? We'll talk about those things shortly. But food, not necessarily #1 priority. They do need to eat eventually, but it's not necessarily the first priority.
And sorry, go ahead.
Oh, I was just gonna say, sometimes it can be not good if you make that your first priority. Do you want to move on to chest and respiratory, like lower respiratory?
Yeah. So we call what we call in vet world upper respiratory, throat and above, this area, lower respiratory, you know, chest, we start in the chest down. So anything that's affecting the lungs or the chest cavity. And so, you know, you're not going to listen to heart and lungs. I mean, you can get a stethoscope, you can try. Hannah has a stethoscope.
I feel like I'm playing doctor though. Honestly, I feel like a little child because I don't necessarily always know exactly how to
Right.
listen like you would. But what I'm listening for as just a foster parent is like this rattling I'm hearing, is it coming from their nose or is it coming from their chest? And you will hear if it's coming
Yeah.
from their chest.
And that's the important thing too. But like the other thing is you can also put your hands on and feel. And in these little guys, most times if it's something pretty like profound and you're going to notice, you're going to feel it. So you'll feel a chest rattle. If you're hearing noise and they're breathing through their mouth, check the nose first, you know, or put your fingers here on the throat and feel, do you feel a rattling here like there's a phlegm ball or something? If you are hearing or feeling noises in the chest that don't sound just like normal no sound breathing, then those are concerning. And things that involve the chest and difficulty breathing, to me, constitute an emergency, something that you want to address pretty soon. The other thing too is watching the breathing, really observing. So how fast or slow are they breathing? And I'm not talking about in the stress period, but as they're resting, a breath in and then a breath out is considered one breath. And so monitoring, are they breathing more than 30 breaths a minute or are they breathing less? And 30 breaths per minute, we're just going to make that sort of like our cutoff. And if it's less, fantastic. Okay. If it's more, then is something causing them to need to breathe more? And that
They're trying to get more oxygen in.
More oxygen. Maybe they're panting because they were from a hot car and they're overheated. You know, there's certain things. So we're trying to look at how fast or how slow, and so is it within normal range or not within normal range? And part of that too is too slow, like the kitten who only takes a breath once every 30 seconds, and we're sort of seeing this. And that's a sign that we're dying. Okay.
Yeah.
So
I think it's really important for people to like know that. And I know it's sad to talk about, but we're all rescuers here. Agonal breathing is something that I think is really important to help people understand what that looks like, what it means, and also how to make decisions around the discussions of euthanasia in a situation where a kitten is actively in the dying process and when that's a humane decision. So what would you say about a kitten? First of all, can you explain agonal breathing? Why are they doing that? And then when is that something that you would try to turn around versus opt for euthanasia?
So if a kitten is doing this sort of not breathing regularly and then occasionally doing that breath, that kitten is dying. That kitten is actively dying. That's not agonal breathing, but it's dying. Okay. So we're starting to have this respiratory arrest, and oftentimes cardiac arrest will follow respiratory arrest. So in this case, get moving, get going, be in a car, driving to the veterinary clinic. If you can, sort of be rubbing and stimulating, okay? Because stimulating a kitten helps them to remind them to breathe, okay? But most animals don't need a reminder to breathe. There's something else that's going on causing them to not breathe. So that's the first thing. Now, where you get into agonal breathing is where they start doing this like very pronounced going once in a while, okay? And that is because the heart has an irregular rhythm, it's shutting down, and it's like this body's reflex to be like, can we breathe and stimulate the heart to contract? Okay. That is essentially, like, death is right here. Again, if you can get to a vet quickly to end suffering, that's your ideal thing. Once they're agonal breathing, you're usually not going to bring them back. And I don't recommend it because that kitten is so sick and those body systems are so shut down that it's time to it's time to use one of our other tools for ending pain and suffering, and that is humane euthanasia. And any kitten in my care who starts the agonal process is put to sleep. Okay. And
I think it's so hard for people to hear that. And I know, like, from experience, I can say, like, I feel like I used to be way more like, I can still, like, we can still do this. But enough times of watching somebody suffer, like, you do realize, I think you start to see where the line is. I think that's why it's important to talk about where that line is, where you maybe cannot come back from, and that is a main decision. I do want to make sure we have enough time to talk about all these things. We're going to stay on for a little longer, you guys, because we found out that we can. So we're going to hang out longer because I want to make sure we have time for everybody's questions. So don't panic if you're like, when are they going to answer questions? I think it's really important, and I hope it's helpful to go through all these body systems together. We have a few more to talk about before we get to questions. One is my favorite subject. Can you guess what it is?
poop.
Poop. Oh my God, how did you know? I'm poor Rachel. I'm sending her poop pictures all the time. Like, look at this poop. This is fun.
I'm making the coffee table book you've ever seen.
I can't wait. I hope that you do make a coffee table book of poop. You'll have like probably 205 people buy it, and they're all on this webinar. So poop. First of all, in the first 24 hours, a kitten may not poop. And is that okay?
Yeah, absolutely. It's not okay according to Hannah, but it is absolutely okay.
No, I always tell people, like, I panic around like 48 hours. Well, around 36 hours, I start going like, and then around 48 hours, I'm like, I don't like this. If they don't poop in the first 24 hours, I'm not worried about it. Yeah, and I think it's also important to say some kittens poop 10 times in a day. Some kittens poop every other day. But what's important is what's coming out. So what are you looking at? You're looking at kitten poop.
So again, familiarizing yourself with what's normal, and then anything that's not normal. And this is the thing where rescuers start to get into this thing of like trying to diagnose based on poop. And while I appreciate that, there's this really cool, easy way to diagnose things based on poop, and it's called a fecal test that your vet can do.
Sure.
That being said, let's just start with normal, that normal, beautiful poop. And kittens nursing on mom have like this sort of nice brown poop. Kittens drinking formula have more of that like mustardy.
Mustard.
Yeah. And different formulas will also give you, stop please, will also give you different consistencies of poop. So some formulas give these like little mustard seed grains, and some will give you like a nice
casing.
Yeah, exactly.
Some of them no casing. I could, it would be a fun field day activity, Rachel, if we got a bunch of kitten poops and then we had to like guess which one was what formula. Is that a fun activity? Do we have good hobbies?
Yeah. Totally.
Normal.
And I just want to say, yes, I understand that that sometimes these tests come back negative. But your vet, hopefully, if you're working with a vet who deals with a lot of kitten poop, can also help to identify, based on color, texture, smell, this, that, and the other, what type of thing is going on and how best to treat it. So yeah, normal or abnormal? Let's go abnormal. So are we getting too much? Is it leaking? That kind of stuff? Are we not getting enough? Constipation? Yes, we will definitely. I think we're gonna have to do a whole session on poop, and that's totally fine. But are we getting Excuse me for 1 second because this dog is being really annoying. Go get that. Go get it.
That's okay. I can take over talking about poop if you need.
Got his toy now and he's playing with it. So I'm sorry now you're hearing the toy play. But you know, are we having diarrhea or constipation? So diarrhea is an emergency if it goes on longer than, I would say, 6 to 8 hours, okay? Because what you're, aside from the fact that it's gross and, you know, you have to clean it, there's a lot of electrolyte loss and fluid loss that happens with diarrhea that needs to be caught up for, especially because kittens have underdeveloped organ function. So they can't really retain fluid and electrolytes as well as an adult animal can. And so that's why it really is an emergency. The other thing too is allowing diarrhea to go ongoing without treatment can actually predispose kittens, or not predispose them, but make them more likely to become candidates of larger illnesses. So a lot of times we have these kittens who have had chronic ongoing diarrhea and it's not really been controlled, and then later they develop FIP. And you're gonna start seeing these connections between ongoing illness and then developing worse illnesses later on in life. And that's not a hard and fast rule, but I will tell you that it definitely sets them up for those bigger illnesses. Okay.
Sure. And I mean, I think you're totally right about, like, so much of the immune system is in the GI tract. And so the fact that, especially if you're taking in a brand new newborn and they have like a sterile GI tract, and what you're introducing into it and how you're managing that GI tract is going to determine so much about their immune functioning. It's a big thing to take on. And I think, like, yeah, diarrhea is definitely something not to take lightly. You should for sure be trying to address that with a vet. And I'm completely with you. Fecal exams are so important. You know, Orphan Kitten Club, our rescue, has an account that we're able to send out samples. I know, just knowing a lot of rescuers, not every organization has the ability to do that for every kitten. And so I think that's where things can get really frustrating for a foster parent who's like, I don't know what's going on. And they're just sort of throwing medications blindly at a kitten because they don't know what's going on. I really would like advocate for people to be doing those diagnostics, but I know in some situations.
I understand that you can't. And I also want to explain really quickly, if we have a sec, why those fecal tests come back negative. Okay.
Sure.
A lot of times what happens is you get a kitten who's been in a starvation state or in a state of crisis, and parasites that exist in the body will be attuned to that, and they'll be like, oh, our supplies that we're getting from this body are poor and they're dwindling, which means it's not a good time to reproduce. And so oftentimes they're not actually shedding eggs at that point in time. And so so you're getting these negative fecals. But once you're getting the good nutrition into the kitten and addressing that, then the parasites are going to be like, oh yeah, we have this great nutrition going on.
Party time.
Yeah, now let's like churn out those eggs. And so a lot of times you'll see, like, 3 weeks into having a kitten, that's like a really great time to do a fecal because it's going to be filled with like party eggs. Eggs. I get that it's not necessarily happening right when the diarrhea is happening, but then, and this is where the poop, where we'll have to have another poop talk, but poop starts to have different looks and different smells, and as Hannah knows, different tastes based on
oh my God. Please clarify that you're joking. Rachel and I have a joke that it's like, well, I don't even want to say it because I don't want someone to take it seriously. We have a joke that you can diagnose by taste, but please don't.
Yeah. No, we are just talking about using your senses when you're examining a kitten, and we always use all our senses but taste. We don't taste anything. And so, essentially, as we start to see different types of diarrheas, we're learning more about which ones are likely causing different things. I don't like the blanket rule of every kitten gets a coccidiostat, like an anti-coccidia medication, or every kitten gets an antibiotic, or every kitten gets a this, that, and the other, without anything wrong necessarily, because that's a poor use of those drugs. And then when we actually do need them, we get resistance. Okay.
Yeah.
So
Yeah. I want to move slightly on to, well, okay, let's see. How do I want to do this? Let's talk about,
sorry, go ahead. Quick
I
pee.
was pee.
When you
right?
stimulate pee, kittens are really, really bad at concentrating their own urine. So if you're seeing really concentrated urine, like neon yellow urine, your baby is for sure dehydrated. And yeah. So
I think with urine, couple things to note. You know, you want their urine to be very clear or very light yellow. And like Rachel said, if it's dark, then definitely something is going on and you need to be addressing their hydration. But also, if you're feeding a kitten on the set schedule for their age and they're not peeing when you stimulate them and they're only, you know, under 3 weeks old, that's an important thing to note because they really should be peeing every time they're stimulated
absolutely.
at their feeding schedule. Talk about temperature. Normal temperature range. How often should you be taking temperature? Should you be taking temperature?
Yes. So I would love if there's one of if there's one of a handful of takeaways from this class, please let it be the importance of learning how to and taking temperatures. Okay. Temperatures are so helpful in identifying the first signs of illness. Okay. So get your lube or your olive oil, get a little thermometer, and don't worry, butthole stretch. Okay. In most cases, you should be able to fit a thermometer. Don't force it, but you should be able to fit a thermometer up the back end. You know, most thermometers have a little metal tip to them. Just make sure you're just getting that in, be very gentle, and then take a temperature. And temperature is so critical because it allows you to see, are we normal? Are we not normal? And if we're not normal, that is a sign that something is going on that we need to address. So there is a very wide variation in temperature. And as kittens age, the temperature goes up. So babies, yes, please use a digital thermometer. Don't use a glass mercury one. Just get one that's like digital to the, point something. And babies, young babies, 97, 97.5, that's an okay temperature. I still recommend having them in a heat source. I mean, I always recommend having them in an incubator or at least on a blanket with a snuggle safe underneath. But getting up into the hundreds is good as well. Anything that's like below 97.5, I'm like, keep on the lookout. I want to make sure that we don't suddenly have the infrared thermometers don't work properly because someone's asking. They don't work properly because the body temperature over top of the fur is different than inside. And then the ear thermometers, not reliable. I had a patient come in last night to the clinic, 105.5 on the ear thermometer. When I stuck it up the tush, 100.1, perfect temperature. Okay, so rectal is important.
There's no getting around it. You got to do it.
Yeah, but it's not the worst thing in the world. And just getting comfortable doing it is really important because it's going to be a really important clue that something is wrong.
Can you talk? I think we will talk about hypothermia in a minute, but something I think is less discussed in kitten welfare is hyperthermia, if a kitten is really hot. And I think a lot of people's instinct is to like go grab a bunch of ice packs. Can you talk about why you don't recommend that and what you would recommend instead?
For sure. So, you're getting a kitten from a situation like someone broke into a car because or some, kittens were in a compost pile and the sun was beating down, it was super hot, and you get these kittens. A lot of times you'll see them panting, doing all this other stuff. You'll take a temperature and you're like, ooh, this is hot. So over 103, we're like, oh, this is not great. Although even up to, even 102 to 103 in a baby is still quite warm. The reason why you don't want to actually get ice packs or anything like that is because if you take a hot body and you apply something super cold straight to that body, all the blood vessels that are open and wide and trying to release heat through that area are going to suddenly constrict. And if they constrict because they're like, oh, cold, ugh, constrict, then that heat can't dissipate through those things. So you don't want a super cold thing. You want cool. So wetting the feet, wetting the bottoms of the feet. You don't want to put a wet towel or anything on top of an animal because heat rises and it actually causes convection and then keeps it in. So what you're wanting to do is just take cool washcloths, wet them and stick them in the armpits and in the groin, because those are where some big blood vessels run, and allow them to just sort of sit and cool, but not be cold. And if you're, and if we identify a hot temperature, take the kitten off the blanket, put it on a cool surface. Obviously, no blankets out of an incubator. Put a fan on them. Some people are saying, yeah, you can rub alcohol on the ears and you can rub it on the pads of the feet. There's now some hesitation about that. So I'm just going to say, yeah, a fan, some cool towels, sitting on a cool wet towel. But then also, if you're doing those things, you're taking a temperature every 15 minutes. Okay. Because we don't want to make them hypothermic or plummet their temperature really fast.
Okay. I'm sorry. I want to make sure we have time to get through everything else. And we already are at an hour. So Rachel, I want to see how you're feeling, if you want to do 90 minutes or if you want to go. I know we have up to 2 hours.
Whatever people want. I'm happy.
Okay. If everybody's having a good time, I just think this is such valuable conversation. I just want to make sure we get through the rest of the body systems and then we can move on to some of the really great questions that we have. I'm seeing so many that I'm like, oh, I really want to talk about that, but I want to make sure we wrap this up. So let's just quickly go through limbs. If a kitten is limping, what are some things that could indicate, and how important is it?
In terms of emergency, not important. Okay. Unless it's hanging off. Even if it's hanging off, not really that important that second in time, because we're talking about the 24 hours of assessment. It's something to take note of. It's something to see about within 24 hours. Limping things like limping could be like an injury. It could be a congenital thing. It could also be colici, which likes to have limping accompanied with a fever. But again, as far as emergency, not emergent.
Okay. The one thing that I do want to call out as a potential emergency, and I think that this comes as a surprise to some people, if you get a kitten in who is paralyzed in their hind limbs, a lot of people think that's an emergency, that they cannot use their back legs. If a kitten cannot use their back legs, it is not, the legs are not an emergency, but the bladder might be an emergency.
Right.
So it's important that if you do rescue a kitten who does not have use of their back legs, that you're just feeling in the abdomen. If you feel that stimulate them to pee. Do they pee? Awesome. Do they not pee? Do you feel like a big soft egg inside of them that's like gigantic? You do need, in that case, right, to go to a vet immediately, right?
The same nerves that supply function to the legs, or lack of function, are the same nerves that are responsible for allowing the bladder to empty. And it's not always that easy. And so those, a lot of times animals with paralysis of the hind legs actually need manual squeezing expression of the bladder to have it to empty. So basically, if you have a kitten who's paralyzed in the back end, who is not urinating when stimulated, you need to see a vet, and that's an emergency.
Immediately. Yeah. Okay. All right. Let's move on. We just got a couple more things to get through. I want to talk about weight and body condition. Body condition, something that you're going to get used to looking at. And some kittens, have that like kind of gaunt triangular face. That's not good. But what is more important that I think Rachel and I fully agree on, if you plan to take in kittens, healthy kittens, unhealthy kittens, you have to have a scale, right? And you have to have a scale that weighs in
grams.
Grams. You have to have a scale that weighs in grams.
Off the ounces.
Yeah, no ounces.
Okay. Grams. We calculate all our medications in grams and kilograms. I don't want you to weigh in fluid ounces. And if you tell me,
it's not a bottle of Coke.
You tell me a kitten weighs 14 ounces, I will look at you cross-eyed because I don't know what that means. So please get into the habit of weighing at least twice a day, 4 times a day if an animal is sick, and please weigh in grams and write it down. Document it.
Yeah.
Because you're going to notice trends.
That's gonna, yeah, exactly. So just tracking. I think hopefully everybody in here is already doing that. But if you're not, let that be a major takeaway for you. A gram scale costs like very little. It can cost like $12 kitchen scale. So you have to do it. It's not optional. I think we can move on from that because I think there's a lot of other important stuff to talk about. The last thing I want to mention is just like behavior and temperament. What is normal and what is not normal? You get your kitten in, you're assessing them. What do you want their behavior and temperament to be? And what are some concerning signs?
Okay. So, a well-fed, comfortable kitten should be sleeping and at ease. So calm breathing, just sort of snoozing. If you like touch them or startle them, they perk up, they might look for milk, they do the sort of normal things. And a kitten that is not doing those things might be agitated. So you might find them just constantly crying or grunting or groaning or making some terrible noise. That's not normal. There's something going on that they need addressed. Sometimes like the hypoglycemic kittens will do this sort of long, like sort of groan thing. It's like my brain's starving from sugar and I don't really know what to do. Those same kittens may either just lay there flat. That's never good. Or you'll see like they can't seem to right themselves. So you'll notice like regular sort of mostly healthy kittens will sort of root around and they'll put their paws down and their nose down and they're looking for a nipple. The kittens who are, not doing that or are trying to do that, but then they fall backwards and they're stuck on their back or they're rolling, things that just don't look like normal hungry kittens looking for food. So, or just, again, just laying there, not
lethargy.
Yeah.
And sometimes with kittens, especially like, I feel like kittens who are like 3, 4, 5 weeks old, if you see them kind of just like glassy eyed, sort of like gazing off into the middle distance, accompanied by being gaunt, you just want to pay attention, especially if things change. I mean, I know we're talking about the first 24 hours, but temperament is, I think, a really good measure. Okay, so we got through the body systems, but the last thing I want to do is talk about, like, we spoke about all these things, what's important, what's less important. The most important, the most common and also important things that you are often going to see in a kitten who's just been rescued are the 3 hypos. Can you talk about the 3 hypos? What are they and why are they so important?
So the most common are hypothermia, low body temperature, hypoglycemia, low blood sugar, hypovolemia, sort of a profound dehydration. Okay. Usually if there's one, the other 2 are there. Okay. And so these should always be on your radar. And even if they're not necessarily profoundly there, you should be sort of assessing for all three. Are you cold? Are you dehydrated? Do you need sugar? That one's a little bit of a harder one, but we'll get to it. Are you cold? So that's where our temperature comes in. Take a temperature. Now, that being said, pop a Snuggle Safe heat disc in the microwave. Take it
immediately.
Out. Yeah, that's my
immediately.
If I hear kittens are coming in, that's the first thing I do. The incubator goes on, and so it starts warming, and a heat disc goes in the microwave, because 9 times out of 10 they're cold. Okay, and even if they're not cold, then they're going to need to be maintained at an appropriate temperature. Second, weight. Weight is not only important to seeing if they're actually eating and gaining from their nutrition. Weight is really important for assessment of dehydration. So if we have these ranges, which I know Hannah has charts on, of like what the average range is for a kitten of a certain age to weigh, if they're less, the body's made up 80% water. So when you lose water, you lose weight. And so learning to weigh and assess whether this is an appropriate weight, and then also when we give sub-Q fluids, making sure that we're having gains on the gram scale because we're hydrating appropriately. And so weight is a super important thing.
Can we sit on that for a second and talk about different ways of rehydrating a kitten? Because there's kind of 3 main things. There's oral hydration, giving kitten fluids through the mouth, perhaps Pedialyte to get some electrolyte support.
Tastes nasty, by the way.
It tastes nasty, but it's an option.
Yeah.
Second, subcutaneous fluids, which we saw a little bit over 50% of the people in here know how to do. Third is IV fluids, which requires hospitalization. Can you tell everybody about how you determine a kitten who needs oral hydration, a kitten who needs subcutaneous fluids, and a kitten who really does need to be immediately hospitalized and placed on IV fluids?
Sure. So the kitten who comes into you is a little bit chilly, but is like actively sort of rooting around, nose down, paws down, looking for that nipple, who, the belly isn't really that wrinkled, the temperature's pretty good, the weight's pretty good. That's a kitten that I'm going to warm to an appropriate temperature and then feed. So I want them at least 97 degrees, and then I'm going to feed. And the thing is, what we can do is, like Hannah does, she makes up her formula with Pedialyte. Instead of water, she uses Pedialyte.
For just the first 48 hours. Because also important to note, a lot of people think you can't give kittens Pedialyte. False, you can. But also, a lot of people don't realize once you open it, it's only good for 48 hours. So open your Pedialyte, use it for 48 hours, and don't use that same thing. Usually 48 hours later, you don't need Pedialyte, hopefully.
Right. And if you do, you need a vet.
Yeah. Yeah.
And then the other part of that is you can also make so normally, everybody has their ratios of formula to water or Pedialyte when you're mixing them up. If we're thinking this animal is dehydrated and we want to make them more hydrated and give them oral fluids, do less formula, more fluid. And you may have to feed them a little more in the first bit to get the calories in, but it allows them to take in that hydration. Okay. And as you're pottying them, you're going to start to see that really bright yellow urine start to become clearer, and you're knowing, and you're weighing, and you're knowing that you're hydrating them. So that's my first, oral fluids. Any animal that is not going to want to eat, or eat willingly, oral fluids are out, because I don't want to aspirate them. Sub-Q fluids are important when we have those sort of sticky, dehydrated, skin tenty kittens that, they're sort of like this middle of the line condition where, yeah, they're going to want to eat potentially, but at the same time, you can just tell they're dehydrated. The belly on the skin is wrinkled. The pee is really quite bright. They just
They need extra
They
support.
need extra support. And that's when we're going to go sub-Q fluids. And do you have a chart on how you select sub-Q fluids?
I think that would be a really good resource for me to create/recreate. I see that a lot of people have clarified they know how to give sub-Q fluids to an adult cat, but not to a kitten, which is so funny because I'm the opposite. Remember, like a couple weeks ago, I was like, wait, how do you do it for an adult? Like, I don't know. I like only know how to do it with babies. The quick answer to that is I personally, I use a syringe with a butterfly needle on it. I just really prefer that for kittens.
Yeah.
But you really do want to get training in person for that because there's risks involved, you know.
Yeah, and the risks involved, I want you to know that if you put too much water in a body, you can put a kitten in heart failure. If you are not putting enough water in the body, or you're not doing it appropriately, like not doing it clean, then you can actually cause infection or not actually be addressing the issue. And then as far as the third category of when a kitten needs IV fluids, those are the kittens that come to you with the eyes sunken, the triangle face, the like just basically aren't moving, or really are just sort of rolling around. And those kittens need IV fluids, and subcutaneous fluids are not going to be absorbed by the body. Okay. And the reason for this is when your body's in crisis mode, it shuts off all the vessels that go to the extremities, including your cells and your tissues, and all the blood goes to the most important organs: heart, lungs, liver, brain. Okay? And those organs are going to have the blood, which means that if you put the fluid in the skin, those vessels are closed. They're not accepting that fluid. It's just going to sit there, and then that bubble of fluid is going to get cold, cool the kitten down, be counterproductive to what you're doing, and not actually help.
Yeah. Thank you for clarifying that. I think that that's really important for people to know, that there is a certain point at which hospitalization is a requirement if that kitten is going to live. So I feel that oh wait, no. We still got to let's talk about hypoglycemia real fast. How do you know if a kitten is hypoglycemic, and what can people do at home, and when do people need to go to a hospital?
Okay. So what I usually recommend to people is if a kitten is decently hypothermic, so the temperature is pretty low when they come in, most likely, and when I say pretty low, anything like 96 and below, they're most likely hypoglycemic as well. Okay. And so I'm going to suggest that as you start giving them fluids, and please never put dextrose in your fluids that you're going to give under the skin. It causes abscesses and tissue necrosis. You're actually going to cause more damage, and the body's not going to absorb it from there. But so my recommendation is for the kittens that you're warming up and need to warm up, those kittens are going to require a little bit of Caro syrup or dextrose in the mouth on the gum.
Orally, yeah.
Mm-hmm. You can actually also put a little bit up the anus, again, gently. And I'm not going to recommend that you guys start with that thing. These are things for people who are a little more well versed in procedures and that kind of stuff. But so I would suggest giving a little bit, and a little is a lot, okay? Because we don't want to spike the blood sugar too. That can actually cause pretty detrimental effects to kittens. But if they're cold, then they're most likely also dehydrated, and they're most likely also having low blood sugar. And what you'll notice is as the kitten warms up, those sub-Q fluids start to kick in, and you've given a little stuff on the gums or in the mouth, you're going to start to see a perk up in energy. And as that temperature comes back up to normal, that's when you're going to start trying to offer food. And food is really the best thing because it gives the body something to break down and hold onto and spread blood sugar around for longer.
Rachel, that is so helpful. I think that the last thing I want to say just before we get to questions is there is an order of operations to these things. I think what we just ended with the 3 hypos, that's usually going to be your starting place, right? Because those are the things that are requirements for life. In the first 24 hours, it is required that you are warm, that your blood sugar is at an appropriate level, that you are hydrated. That is required. So those are the first things. And then you go down that list, right? When you're talking about the plan part of your SOAP, you have your assessment and then you prioritize those things. So first prioritizing requirements of life and then going down in a timely manner with the other things, but once the kitten is stable.
And a lot of people have said, what is a little? To me, a little is like 0.3 cc's.
Depending on the age too.
It does depend on the age, but I usually say like go 0.3 cc's and see what happens. Give it a few minutes, see what happens.
Okay, so we have a lot of questions, Rachel. I'm trying to find out what time we actually can go until, but I have some questions that came in advance that I want to just quickly go through, and let's try to get these answered in a timely way so that we can get to as many as possible. I sort of grouped these together. So we had a few questions. Tara in Texas and Ridgely in Indiana both had questions about quarantining kittens. Tara asked, I'd like to be able to foster more than one group of kittens at a time. If they're quarantining, can they be in the same room but in different enclosures? I think we can probably both answer that. This is something that both of us do, right? And so the answer is yes, they can be in the same room in most situations, but the more important thing is that you're using separate supplies, you're being hygienic, you're washing your hands. You probably should just be wearing gloves, but especially if you suspect contagious illness, you're wearing gloves. What else would you add to that, Rachel? Just,
separate spaces. The rule, if they're sneezing, the ideal rule is a 25-foot barrier. Okay, that's for a shelter. If it's in your home, try to put as much distance between. Try to maybe not face them in the same directions because, air particles. And then again, separate supplies, cleaning your stations that you're using, and sometimes you don't even think about it, that you're like, oh, I'm going to go heat this bottle up and pop it in the microwave, and you're wearing those gloves, or it's, whatever, and you're touching the same buttons and then you go back. So the one thing I caution you about wearing gloves, and this is a problem with technicians as well and veterinarians, once you wear gloves, sometimes you don't feel the germs on you. Like you don't get that feeling of like, oh my God, I probably have germs on me. So if that doesn't stimulate you to do that, then just wash your hands
Wash your hands a lot.
But just remember that as soon as you're leaving one space, stripping down, taking your things off, and the importance of washing hands, like I can't even tell you how.
So another good thing that's just a habit to get into, I always have a bottle of my disinfectant. I use rescue disinfectant. I think you do too. Yeah. And I always have a fresh bottle of it. And anytime I'm wrapping something up, I just spray all the things I know I touch a lot. I spray the microwave. I spray the faucets on the sink. I spray the soap that I am washing my hands with and touching the pump. I spray the doorknob. Things that I know I'm touching a lot, I just spray them because it's good to just get in the habit of disinfecting.
You spray your rescue bottle? You spray your rescue bottle? Okay.
You got to spray everything. I wish we could just get like a big, like one of those big power washers and just like spray my life with rescue. Ridgely had asked about if there is a litter of kittens and one is known to have a contagious illness, do you separate them from the others or do you keep them together? I think this is a complicated one. And I think it's complicated. What would you say to that?
So my answer is that every situation is individual. Okay. There's no blanket rule for anything, but the answer is if it's a risk versus reward system.
Yeah.
If you have a litter of kittens with and one has a respiratory infection and the rest don't, do they likely potentially have been exposed and whatever? Sure. Do I separate them? No. That being said, you know, and the other thing too is if I have only two kittens in a litter and one has an illness and they've been together the whole time, I often will not separate them because I think the benefit of having that interaction, that warmth, that sort of camaraderie with that other animal is actually more beneficial to them and helps healing. So I take that very seriously. Now, that being said, last night at my clinic, I have a nursing mom cat who's doesn't have a lot of milk, and she's not the greatest mom because she was forced into a situation she didn't want to have, and she's scared and everything. And one of the babies wasn't doing really well, and I did separate it. I separated that baby from the siblings because I felt that would be in the baby's best interest. And
sure. So it's case by case situation, but I agree with you that in some or a lot of situations, you can assume if one kitten has been exposed to something, they're all together, they've all been exposed, and the stress of moving or being taken away from your family, it's just something to consider. I think it is case by case.
Yeah.
Okay, I want to move to some other questions. We have a lot of kind of like general care questions that we may have done a pretty decent job of answering already. But a couple people have asked about feeling like they get in a kitten and then they do okay for a couple days and then decline. There was one person who said that they kind of have this like protocol they do where they're giving every kitten Tylosin, which I think you kind of already answered, but sort of our perspective, both of our perspective, I think would be that you should not just be like throwing antibiotics at somebody if you don't know what's going on with them. And I can say from personal experience, every time Rachel asks me to give Tylosin to a kitten, I'm like, no, because I know it tastes so horrible. So unless there's a real diagnosed reason for it, I don't know. What do you say, Rachel, to that?
So here, I think this brings up a few issues. One, if we're having a continual issue with kittens not doing well, then you need somebody to go through your protocols with you, from the environment, the temperature, the food, the everything, the medical care, what you're doing, and poke holes in it. Because if this is a constant ongoing issue, then this is important that you discuss it with somebody or several somebodies and poke holes in what you're doing and figure out where to make changes. That's the first thing. Secondly, anytime you pick up a medication that has not been prescribed by your veterinarian to an animal, that is considered you practicing veterinary medicine in your home, and that is illegal. And it frustrates the heck out of me when people do this because they're like, well, I can go buy Clavamox from Tractor Supply and then I can go give it and whatever. And you giving a medicine or an antibiotic doesn't just fix things, okay? I'd like to say it's magic. It's not. There's a lot.
It's magic where indicated, and you don't know where indicated without like having a medical professional.
And so, it's, aside from the fact that it's illegal, and it's also improper use of medications, and you don't know if what you're doing is actually going to have detrimental effects, because it's not just an antibiotic. These have major consequences. And then the other thing is, if we're having issues, and that you tend to have issues right around this point, then make sure you have a vet visit scheduled at that point. Have somebody who's objectively going to assess what's going on and try to help you.
Okay, we have several people asking questions about feeding kitten protocol. Before you answer this, I just want to kind of talk about the verbiage of feeding kitten. It's something I was guilty of when I was newer to kitten rescue. Kind of, a lot of people would say, oh, they have feeding kitten syndrome. It's a term that really frustrates me because it just sounds like, oh, I don't know, they just like faded away. But there's always a reason that your kitten is sick. If your kitten is sick, there is a reason. And there are like body systems that need to be addressed, and it's very, very case by case. So we have a question from Olivia. She asks about feeding kitten protocol, and she said, my shelter's feeding kitten protocol is to wrap a kitten in a blanket covering face and ears other than mouth and nose, then wrap the burrito in a heating pad and giving Caro every 3 minutes. Is this reasonable? Rachel.
The answer is it sort of. The answer is that feeding kitten, and we're just going to use feeding kitten to refer to all kittens who are not doing well. But those, what you're doing is you're doing Band-Aid care. You're just putting Band-Aids. Caro every 3 minutes and warming is a Band-Aid, because you're not addressing why the animal is fading. Okay. And so putting a Band-Aid on is going to stop the bleeding for a few minutes to buy you some time to get to a veterinarian, but it's not going to fix the issue. Okay. Yeah. Because the low blood sugar and the low temperature are not because the environment's cold or you're not offering them food. It's because there's an underlying disease process going on, and that needs to be addressed. And you're not going to really, you're going to make a difference for a little bit because you're not addressing the underlying issue.
I really appreciate you saying that. I think sometimes people are looking for like a way to not have to go to a vet, but if you're at a situation where you're burritoing a baby and giving them Caro syrup every 3 minutes, you might as well be doing that in the passenger seat while somebody drives you to a vet. So that's what I would say about that. I know it's a challenge, and I know it's especially a challenge in shelters. But yeah, okay.
That's where taking these temperatures so that you don't suddenly find yourself coming upon a kitten with a temperature of 91 degrees, etc. That's why you're not suddenly finding yourself in this scenario.
That is a really good point too, is prevention, because sometimes a kitten is going to come to you not in that condition, and you can prevent them from becoming in that condition by anticipating their needs, because you're checking, are they dehydrated, and you're addressing it. You're checking, are they cold, and you're addressing it. So I think
they didn't gain weight after this last feeding. Like they're still stayed, in this last 12 hours, they've stayed the same weight. I should be on alert now.
Yeah, exactly. We don't want these kittens to be falling into this condition with us. Maybe if they come to us in that condition, then, you're looking at, is this a kitten who needs to go immediately to a vet?
But also knowing that kittens will sometimes fall in that condition, no matter what you do.
Sure, that's true too.
Not to beat yourself up about it, but to, allow yourself time to mourn, etc. But then look at it and say, okay, what could I have done differently in the future?
Totally agree. So let's move on to some other questions. I got a hard time out. We have about 20 more minutes to answer questions. So let's go through some of these. I really want to talk about this question from Eva. It's about pneumonia. She lost her first kitten a few weeks ago due to pneumonia, and I'm so sorry to hear that. She wants to learn as much as she can, and what skills would we recommend she pick up for future cases like that?
I think anytime, hi folks, anytime, it's like black animal here.
I know, she's surprised. I didn't even know she was in this room. The door's closed.
Anytime you have a kitten with upper respiratory signs, I would like you to try to see a vet within a 24-hour period. So that's the first thing. Now, if that vet doesn't prescribe medication or doesn't feel medication is indicated, then I'd like you to make sure you ask your vet, okay, at what point would you would you suggest I bug you again for medication? Like, what are my parameters? If you're not going to prescribe meds right now, what are the parameters for when I come back to you?
Mhm.
That's first. If you're seeing any worsening, like their body weight is not increasing, temperature is going down, eating is sort of intermittent or not as good, then those are signs. Again, I want you to go to a vet. Or difficulty breathing. Anytime you see those signs, you're wanting to go to a vet to try to really get appropriate antibiotics and treatment for these guys. Now, if they are not able to breathe off of oxygen without oxygen support, and you don't have an oxygen concentrator at home, which most people don't, then you have to have a really good sort of chat with your vet about what is in the best interest of this kitten in terms of quality of life. Okay. And even if you do have an oxygen concentrator at home, just because you have oxygen doesn't mean that is the best quality for this kitten. So it's assessing how bad this is and what is the best tool that we can use to make this kitten comfortable. And again, this is where getting comfortable with these discussions about euthanasia, and that we aren't going to save everyone, but it's not about saving everyone. It's about making sure that we do what's in the best interest of animals for their comfort and preventing suffering. And those are.
Thank you for that. And I will say, pneumonia is a really, really difficult thing with kittens. When it's like my least favorite thing to have somebody bring me a kitten who has pneumonia, because I know that it's a very difficult thing to get over. So the one thing I would add is, if you don't have a nebulizer, buy one. They're not expensive. It's an easy thing to do at home. Even if you don't have medicated solution to put into it and your vet's not recommending that, get saline, and it's not going to hurt.
Do not put tap water.
Yeah, don't put tap water in it. It's not like
not a humidifier.
It's not a humidifier. Yeah, but get some saline. Like, you can go to the drugstore and get a nebulizer and saline, and that's not gonna harm them, right? Mm-hmm. But it may be helpful.
It helps to moisturize the airways and helps break up junk in the airways. Also, if you don't have that, or you can't get a nebulizer, which they're available on Amazon, and having lived in Europe for a while, you can totally get that on Amazon. You can also run a steam shower in the bathroom, and then sit with your kitten in the bathroom for 20 minutes and just, help moisturize.
Coupage.
Gentle though.
Yeah. Coco's being my coupage model. When it's a kitten, it's a lot smaller, might be one finger. Okay. We have a couple questions. Actually, we have a lot of questions about people who are like, okay, this is great, but I don't have a good vet who's used to treating neonates. Ashley in California was asking about having vets who are hesitant to prescribe any medication to a neonate. We also have another person who said, I have a great vet, but they don't have any experience with neonates outside of the ones I bring them, and they're not especially interested in neonates. How do I find someone or get somebody on board? It's a difficult question.
It is a difficult question. And you will find that all vets have their areas of interest. As far as finding a vet with an area of interest, you either want to ask around, and you can call around to clinics. Do you know any vets who have a special interest in, neonatal kittens, pediatric kittens? Usually I shouldn't say usually, everything's so different, but if there is someone, usually people will know about that person. Second, if you can't find that, ask if there's a vet who'd be willing to work with you and you guys learn together. I didn't just start out just like having all this knowledge. I was willing to learn and explore. And there are other things, like there are other types of animals that I treat that I didn't start treating because I had a desire to treat them, but I had a desire to work with my clients and say, yeah, let's learn these things together and figure it out. And I'll do research and you do research, and we'll come back together and we'll powwow. So, that's another thing. So it doesn't have to be a vet who has an interest. It just has to be a vet who is willing to work with you. Now, if you have a vet who's not willing to prescribe antibiotics to neonates, then I think you need to try find another vet. Okay. Because vets don't really love to be told how to practice medicine. It starts to get, it's sort of like someone telling you how to do your job, and people get sort of offended by that. I'm not saying they should, I'm just saying they do. But all animals can take medicine and do need medicine, and especially this very vulnerable population who not only has underdeveloped organs, but a poorly, if at all, functioning immune system. They need medicine. So we need extra care. And so we need people who are not like, oh, they're too little to do things. We need people who are willing to whatever. And you can always say, I accept the risk. I accept the risk. I'd like you to prescribe an antibiotic, and I accept that it may not work, or this animal may pass away, and I'm not blaming you, but I really feel strongly that this should be done.
Okay, let's get through some more questions. Layla was asking about purple-ish bellies. So let's talk about that. It's not good.
Purplish belly is usually not good. Usually refers to like some sort of infection where that's causing the body to not really perfuse the abdomen properly, and or infection in the abdomen, in the intestines. So you're going to want to see a vet about
Get to a vet. Yeah. Okay. So many questions. Oh my goodness. Let's pick some more questions. Sorry, I had some. Let's talk about, several people had questions about tube feeding. I don't know how many people in here are trained in tube feeding. Tube feeding has a really specific place, I think, in critical neonate care. Sometimes it's going to be a less safe thing to do. Sometimes it's going to be an essential thing to do. But somebody's asking about feeding charts for tube feeding. I don't know that exists, but maybe we can talk about some of the parameters that we follow. Like, I know for me, and then you correct me if I'm wrong, Rachel, when I'm making a decision to tube feed a kitten, first of all, it's not the first, we already talked about food is not the number one priority. But if you've gotten to that place where you're 12 hours, 24 hours in, this kitten cannot eat, they do have to get something in their stomach. For me, it's important that you're not overfeeding them and you're like kind of slow and steady working them up. So I might dilute the formula more, and I also might give a much smaller quantity than what I would expect them to take orally. So if I'm expecting orally, I'd like this kitten to take 4 cc's of fluids, I might tube feed them 2 cc's of fluids and then go from there. But I also really want to say, don't tube feed kittens if you're not trained.
But also, and I also want to say, and this goes back to the whole quality of life discussion, just because you can doesn't mean you should. Okay. So evaluating why you're tube feeding them and why they need tube feeding, and are you just doing it as like, it's another thing I can do to try to make them survive, versus they have a pretty good chance of survival if we do these things combined together.
Sure. Okay. Dawn is asking, what's the best way to know early on if a kitten has pan-Leuk? She recently fostered a litter and the first passed before they had a diagnosis, but she also added she saved 2 of them. They got adopted together and are doing great. So go, Dawn. That's awesome.
Yeah.
Pan-leukopenia is a really, really difficult thing. I might cry while talking about it because, a lot of you know, and Rachel knows better than anyone. It's something that we've been dealing with recently here. It is very, very not what you want to hear. But can we talk about diagnosis? Because Rachel, maybe you know this, but in the past, I've had vets be like, oh, we'll send out a PCR. And I'm like, great, it'll come back in 5 days when they are going to be either dead or over it. So while that's something that you can do, what are some other things you can do in the meantime?
So first, you can do a parvo or pan-Leuk snap test.
And it's called a canine parvo snap. which
It is.
surprises people and I think is important to clarify, does pick up feeling
Yes.
panleukopenia. Yeah.
So that's the first thing, and it results in 10 minutes. Now, because the body has to be shedding Panleuk cells, these tests are only about 50 to 60% accurate. So you can still get a negative and have Panleuk. If you're at a vet clinic, doing something called a CBC, you need a tiny amount of blood, and you check the white blood cell count. Panleuk makes your white blood cell count plummet. So that's another way of confirming. Takes 5 minutes on the machine. Okay. Another way is, let's say we don't have a diagnosis. We don't have snap tests. We don't have CBCs. We're not sure. But the kitten's having diarrhea, not wanting to eat, maybe vomiting, whatever. Treat like it's
Assume they do.
Yeah.
Mm-hmm. Mm-hmm.
And there's nothing wrong with that. And also starting your isolation sanitation protocols. But
sure.
When in doubt, treat the symptoms.
Absolutely. And that I think is a really important takeaway, is like all disease is a series of symptoms, and especially with a virus, it's not like there's like a pill that you take if you have Panleuk. It's managing the symptoms. So whether you know they have it or whether you don't know they have it, it's good to assume, take those isolation protocol, do what you can to diagnose, but more importantly, start helping them with their symptoms. Because if you have a kitten who is like leaking, gooey, stinky diarrhea, that's a problem, whether it's Panleuk or whether it's not Panleuk, right?
You still have to treat that diarrhea.
Mm-hmm, mm-hmm. Okay. Okay. On that same kind of note, Susan is saying she was hit with panleukopenia last year. She cleaned with bleach and Parvasol cleaner, thought it was safe, then lost 2 of the 4 next that I got in. I'm so sorry. I'm like just so sorry to hear that. And this is a unfortunate thing that can happen. I've held off several months. I'm afraid to try again. Any tips to knock it out, or how long do I need to wait to foster again?
Panleukopenia survives for a year on surfaces, okay? And it's not just your hard surfaces, it's your soft things like your couch, and places you wouldn't even think. So like, some people get heebie-jeebies from the maggots. I get heebie-jeebies from the idea of Panleuk, because I'm like, it's everywhere and I can't see it. So my answer is, if in doubt, wait a year. If that's not possible, then pick an area of your space, where you have an incubator. Make sure that area, there's no soft things in that area that aren't just freshly washed and out of the dryer. Clean your incubator, clean your table, clean your supplies. Anything that's not cleanable, chuck it, and start there. And always coming in with washed hands, gloves, that kind of stuff, changed attire from the rest of your house, and try to go that way. There's also UV wands that you can use on soft surfaces and steam cleaners. But yeah, it's a very scary thing.
I want to add that, like, when people say like you can't foster after you've had Panleuk, I mean, a hospital doesn't shut their doors for a year after infectious disease comes in. An animal shelter doesn't shut off an entire room for a year every time they have infectious disease. So it's important to say, like, yes, you absolutely can continue to foster, but before you do, you really want to be sanitizing. And bleach is something that you're not going to put on every surface. Like, I doubt that you want to bleach your couch. But there are other things you can do, like Rachel was saying, with steam cleaners, with sanitizing agents like Rescue that are maybe not going to be damaging to soft surfaces in your home. But really, it is all the things you don't think about touching: doorknobs, your coffee table, your phone.
Underneath, your keys, your car keys, your steering wheel.
Yeah. I hope that that's helpful, and good luck. Good luck to you. Okay, we have 10 more minutes. We got 10 more minutes. Let's find some good ones. Do you want to go through some of these Q&As too and see if there's some that you feel are really high value questions? That I think we should do high value questions that are going to help a lot of people. Really quickly, I see multiple questions. Can gum color help you determine if a kitten is hydrated?
Can gum color?
Can gum color tell you if they're hydrated?
Not usually.
No, okay.
Not in kittens. You're going to want to look at the color of the pee, like how concentrated it is and whether the belly is wrinkly. Those are going to be two of your best ways.
Some more quick questions. Anna asks if 30 breaths per minute is a good respiratory rate. What is the benchmark for too low?
Breathing once every 30 seconds or fewer.
Right. Taking those like
someone says when can we start deworming a newborn, and what signs can indicate newborn has parasites? You're going to want to start deworming at 2 weeks old with pyrantel. And these are things that you might be able to find online for information. Also Revolution, there is topical Revolution for kittens that you can use straight as newborns. I put Revolution on all my babies because it does intestinal parasites, external parasites, and also some certain skin conditions like mange. So
important to clarify, you're referring to prescription Revolution for kittens and puppies under 8 weeks.
Under 8 weeks.
Not your dog's Revolution, not your adult cat's Revolution.
Don't play around with doses.
Don't play around with doses, not worth it. I see a couple questions about favorite diarrhea medicine. Really important to indicate there's not one cause of diarrhea, therefore there's not one medication for diarrhea.
But I am gonna say that metronidazole or Flagyl tends to be a first go-to for diarrhea medicines in most people. So keep that on your radar, and you can always ask your vet about it. Okay.
I feel like with us, when we send out a fecal and it comes back negative, but there's still a lot of stuff going on, that's often what you'll have me reach for is the metronidazole. So, okay. How would you treat an anemic kitten? Can we answer that quickly?
How can I treat an anemic kitten? Get rid of the cause of anemia. So if it's fleas, a dish soap bath and then a comb through and then Revolution. If they're bleeding intestinally, like your vet's decided that that's the cause, then doing gastrointestinal protectants. But basically you want to rule out the underlying cause. If they're so anemic that they're dying, they may need a blood transfusion. Again, something to do with your vet.
Hospital. Okay, I'm going to answer a really quick question. Someone's asking about the brand of scale I use because theirs makes them really frustrated. And I got to say, mine makes me really frustrated too. I think that the trick with scales is kitchen scale. So just look up kitchen scale. I like a bigger kitchen scale personally, because when I put a kitten on it, if they're in a box and they go away to the one side and it's sort of not centered in the scale, that's frustrating. Kitchen scales can be frustrating. I would just get a larger one, use some kind of bin, or like I use the refrigerator bins. And then if they're loose in there and they're walking around in the bin, the weight's going to be like 350, 375, 362, and it's going around, you can't get an accurate weight. If you kind of stuff them in there with like a blanket and they're more still, you're going to have a better experience with your scale. But I don't have a specific brand that I recommend. Do you, Rachel?
Whatever one I buy at the time.
I know. Yeah. I wish I had a better answer for that. We're always annoyed with our scale, but we make it work. Do you see any other ones that you want to answer? We have 6 minutes left.
Can ears tell age 2? Sure, they're closed until 2 weeks. For neonates found outside, if they're not actively dying, let it come back. For kittens found outside, I'm going to answer that one. I would say you can try keeping them warm. Put a heating disc in a box. Make sure they're protected from the elements, and then watch. I watch for 8 to 12 hours as long as they're okay. And that's to make sure mom comes back. You can also set a trap for mom you know,
Mhm.
because
I have a lot of videos on reuniting mom and babies, so you are welcome to look up reuniting kittens and mama, and you'll find a couple videos on that. Darcy and Diana both asked about joining an orphaned neonate with a surrogate mother. Quickly, I want to answer that. I think that that's also like a cost risk thing, because anytime you're introducing two animals of unknown health history, you could be exposing someone to something bad. Go ahead.
I'm super pro.
Really? Okay. So
Super pro.
I think it depends on the situation. For me, it depends on the situation.
In all
Um,
situation.
it depends on the situation. I can say I've been in an animal shelter that this was years ago, many years ago, in an animal shelter with a high euthanasia rate for neonates, and I was in their room, and they had a little neonate come in. It was 2 weeks old. They said, we try to give them canned food. If they don't eat it, then we have to euthanize them. And I'm looking at a mom with the same age kittens, and I was like, let me help you out here. Took the kitten, put them with the mom, started latching, and I was like, cool, done. Would I usually recommend that? Maybe not. In that situation, I was like, easy solution. There you go. So I think, again, it's a case by case situation. A lot of the time, I think it probably is indicated.
I just think there's so many benefits to mom aside from milk. There's warmth, socialization, all these kinds of things. But you're right. If mom has like a horrendous infection, or kittens potentially have Leuk and whatever, like you just
you're exposing her babies to that,
or her, or like anything like that. Yeah.
Yeah. Well, we only have 3 minutes left, so I think we have to just say goodbye here and wrap it up. I just want to thank everybody for participating, and maybe just mention where people can find me and you to learn more. Rachel is on Instagram at we_vet, so
WEE, like little.
we_vet. I am Kitten X Lady. You can also find a lot of information on my website, kittenlady.org. Our nonprofit that we are both on the board of is Orphan Kitten Club. We work our butts off for this organization, and we're so grateful for the opportunity to do that. So anybody out there who is a supporter of that, we're really grateful for as well. And hey, I thought this was going to be half this length, and we can talk, man. We can keep talking, but we're getting kicked out. So next time we'll do 2 hours on poop, and just make sure you're not eating anything during that. We don't really care though. So anyway, thank you guys all so much for being here. Rachel, thank you for spending so much time on this. I thought this was really fun. Thank you guys.